Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my intro and disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, videos, review books, and more to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well. Now, I always give the disclaimer slash reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, but any of these questions that I have designed and created are based on the current guidelines that are being tested on the ANCC as well as AAMP exam. If I am doing any videos teaching you on things that we currently do in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into our questions for today. Question number one states a patient presents to the office today with complaints of pain and stiffness for long periods in the morning. Based on the patient's complaints alone, what is the best differential diagnosis? Is it A, osteoarthritis, B, osteoporosis, C, rheumatoid arthritis, or D, muscle weakness? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first to ensure you're answering what is even being asked, right? So here it says, based on the patient's complaints alone, what is the best differential diagnosis? So, all right, the patient presents to the office complaining of pain and stiffness for long periods of time in the morning. All right, so think about this presentation. Pain and stiffness, we're really thinking arthritis, right? That's where our mind is probably most likely going. But one of the key things I'd like y'all to remember osteoarthritis, the pain is for short periods of time. It's brief periods in the morning, right? The pain and stiffness. Whereas with rheumatoid arthritis, that pain and stiffness in the morning are for long periods of time. So pay attention to that if they ever give you that duration as a description. So C, rheumatoid arthritis is the best answer. All right, question number two. The nurse practitioner and NP student are discussing SSRI in the elderly population. The NP student inquires about the best SSRI to prescribe for the elderly population. What is the appropriate response by the nurse practitioner? Is it A, sertraline, B, Parnate, C, lithium, or D, Paxil? Take a moment and tell me what you got in the comments. Tell me what you got. Tell me what you got. All right, so stem of the question states, what is the appropriate response by the nurse practitioner? All right, so what are we responding to? Nurse practitioner NP student are discussing SSRIs in the elderly. The NP student inquires about the best SSRI for elderly population. All right, so one, you need to know your medications because if you can't identify them, then that's going to mess you up already. Note endings and group them together based off of drug classes. So one, um, you can eliminate B and C, right? Because Parnate is an MAOI, lithium is a mood stabilizer. Now, A, sertraline, aka Zoloft, is an SSRI, and D, Paxil is also an SSRI, right? But Zoloft is the best medication that you can prescribe to the elderly population because that's the one with the least drug interaction and the least side effects in that population. Okay. So A, sertraline is your best answer. Make sure, and it's hard with SSRIs because there's many things that have that INE as the ending. So usually I tell you to know that, but be familiar with those common ones. Your sertraline, your paroxetine, um, all the teens, eens, all the things. Be familiar with the common ones. All right, and lastly, question number three for today. The nurse practitioner notes that the patient's prostate is boggy. Based on this finding and presentation, what is the best diagnosis? Is it A, epididymitis, B, prostatitis, C, BPH, or D, prostate cancer? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, based on this finding and presentation, what is the best diagnosis? All right, so they're asking about a diagnosis. You know, you have to run it back and see what the assessment findings are. How do they present? What is the provider stating that they found, right? So here is talking about the nurse practitioner on a digital rectal exam has noticed that the patient's prostate is boggy. Know those key descriptions, right? So epididymitis, we know that's not yet. Really, when we're diagnosing epididymitis, we're more so looking at that Prin sign, that cremastic reflex, right? And it would be positive. You know, they come in with that uh, testicular scrotal pain. When lifting these, they should have relief from the pain, making the Prin sign or cremastic reflex positive, right? Prostatitis, yes, that is your answer. Classic description of prostatitis is a boggy, enlarged prostate, right? So B is your best answer. Prostate cancer, more so, it will be like firm. They may have nodules noted, but for prostatitis, boggy prostatitis, all right? All right, you guys, I hope you found this helpful. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure you meet me back here. If you need any of the resources that I offer, you can give us a call at 803 400 6864. You can also shoot a text to that number or shoot us an email at the nursing studio, the number one, at gmail.com. I offer a review book option in the ebook and paperback option, both link in the bio. I also offer a self-paced review course that you can do independently at any time. You can watch the videos as many times as you would like. That's also linked in the bio of the channel. I have a 5-week review course. The next one starts June the 10th, and I have one more space available for that class. And then my one-on-one sessions are strictly customized to your needs. So I always say, just give me a call or shoot me an email so that we can see, engage what you really need and where you are, and structure and work with you. Okay. So if you need any of the resources, please feel free to reach out. I am happy to work with you guys. I appreciate all of your feedback and all that you do. But you know what to do, you guys. Make sure you meet me back here. As always, happy studying. Bye, y'all.